Cl0p Ransomware has struck again, and this time one of the UK's largest healthcare organizations, Barts Health NHS Trust, is confirming a significant data theft. This video is sponsored by Stonefly. More on that at the end of the video. According to the trust, Cl0p accessed a database containing invoice information and exfiltrated files that included the personal details of patients, staff, and suppliers. These files have now appeared on the dark web, prompting Barts Health to issue notifications and warnings about potential scams. The compromised invoices contain names and addresses of patients who were required to pay for certain treatments or services at Barts Health hospitals over several years. This isn't medical record data, nor does it give attackers direct access to clinical systems, but it does expose identifying information that can easily be abused in social engineering campaigns. The trust is advising paying patients to check any invoices they received following treatment to determine what information may have been exposed. It wasn't only patients who were affected. Former employees were also caught in the breach, specifically those who left the organization with outstanding salary sacrifice arrangements or unresolved overpayments. Their details appeared in some of the compromised files. Suppliers weren't spared either. In fact, suppliers accounted for nearly half of all potentially compromised records. These include companies and service providers who invoice Barts Health for goods or services. The breach also extends beyond Barts Health itself. Barking, Havering, and Redbridge University Hospital's NHS Trust was impacted as well because Barts Health provides accounting services for them. The organization says it is working closely with the affected trust to minimize harm and coordinate response efforts. The trust stresses that internal systems remain secure and electronic patient records were not accessed. This incident specifically stems from a vulnerability in Oracle's e-business suite, a flaw exploited by Cl0p earlier this year to target dozens of organizations. Many victims were unaware of the 0 day for months, which explains why the stolen Barts Health files appeared on the dark web only in November, even though the actual theft occurred back in August. For now, Barts Health is taking legal action to block the publication or sharing of the stolen data. While the trust notes that the leaked files are only available within encrypted dark web forums, not publicly indexed, the risk isn't zero. Criminals can use the exposed invoice data to craft convincing scams, attempting to extract more sensitive details or even payments from unsuspecting victims. Barts Health has issued an apology, stating it is working with suppliers to ensure this type of breach cannot happen again. The incident underscores the ongoing threat of ransomware groups exploiting enterprise software weaknesses and the ripple effect this can have across healthcare organizations already operating under constant cyber pressure. And now a word from our sponsor. Get a Veeam, Rubrik, Commvault immutable and air-gapped backup and disaster recovery appliance for $11,995. Contact sales at stonefly.com for details. Subscribe for more cybersecurity news. Thank you for watching.